Hello everyone. So welcome to another day of high yield Usmle questions, and today we will be talking about musculoskeletal system. So a 56-year-old male presented to the emergency with signs and symptoms of suggestive of stroke. The patient is diabetic and hypertensive for 10 years, so these are the risk factors for the stroke. Also smoked one pack of cigarettes, so that's another risk factor for stroke. The patient's stroke is managed and he is put on appropriate medication, including a statin. So the question is asking which of the following tests should be done before starting a statin. So the first, they say that CBC, that would be wrong. Statin does not cause any of the hematologic abnormalities. You do monitor CBC for clozapine, which is a antipsychotic that is really effective, but not first line because it can cause agranulocytosis, and it's often asked. This is often tested. The clozapine. So you do every if the patient is on clozapine every week, you should do CBC every week. So another is chest X-ray. This is also wrong, and chest X-ray can be done, for example, for if you're putting the patient on anti-TNF because it can cause TB. For example, infliximab. This is often really high yield to know. And then we have the renal function tests. That's also wrong. You do this, for example, if the patient is put on, for example, acyclovir because it can cause what is that called? The crystal nephropathy. So the crystal induced nephropathy. But you can also do it, for example, for metformin because if LFTs are deranged, if the renal function test RFTs are deranged, then metformin is not a good idea because it can cause lactic acidosis in those patients. So the right answer is TSH. So remember, if the patient is subclinical hypothyroid, because subclinical hypothyroid. So these patients, subclinical means that the patient does not have symptoms of hypothyroidism, but they are hypothyroid based on tests. So these patients, because hypothyroidism also causes myopathy, and statin also causes myopathy. So this can add, and it can lead to statin myopathy. So these patients have increased risk of statin myopathy if you have hypothyroid patients. So that's why to check for thyroid status to rule out hypothyroidism, you should do TSH. Remember, if there is mild myopathy with statin, myopathy in general, you can just switch to another statin that has low that has low risk of causing myopathy. Like these include fluvastatin and pravastatin, and the third is pitavastatin. So these three have low risk for causing myopathy, so you can switch to these. But if the patient has rhabdomyolysis, which is a very severe one, or severe myopathy, then you stop statins, all statins. There have been reports where it was successfully given, but usually you just stop all statins entirely. So hope this video was helpful, and if anybody needs tutoring, you can email me here.